From time to time, the QEH issues notices like this one, asking people with cases that are not urgent to avoid the accident and emergency department due to a significant increase in patients. Chief Executive Officer Neil Clark says a team will be evaluating the hospital's plan for these situations over the coming weeks.
And if they're used to 5 patients an hour coming through and it's gone to 10 or 15, we know we're going to be busy for the next 5 or 6 hours. And what we need to do is put resources down there at that time as the patients are coming in to address what I would call a bottleneck of patients coming through the system. To do that, they've got to have trigger points so they know when to respond, and then they need to know how to respond. So we've commissioned a piece of work at the moment that the team's working through, and they'll be working over the next 12 weeks to identify what are those different stages of the patient flow through the A&E department, and what are the bottlenecks that make a patient wait unnecessarily. Be that diagnostic, be that waiting for specialist opinion, be that waiting for a bed.
Mr. Clark was a guest on CBC TV8's current affairs program, The People's Business, where he also revealed plans to acquire new equipment for the AED.
There are challenges then for the patient who's in the A&E waiting for diagnostics. And to address that, we're bringing 2 new pieces of equipment into the A&E department this year, a CT scanner and an X-ray machine. That means we don't have the challenge of trying to move the patient to the diagnostics department. The diagnostic department will be in the A&E department, and that will be enable better flow through the systems.
Director of Nursing Services, Henderson Pender, says the addition of new nursing practitioner posts should also help cut down wait times in the AED and at polyclinics.
These practitioners will be able to affect care to the patient who is, say, a category 3. These are persons who would come to the accident and emergency department and may have to wait for a prolonged time because of the nature of their complaint. But with the training that the nurses will receive, they will be able to see them, treat them, and dispose of them in an effective manner.
Meanwhile, communications specialist Shane Seeley is reporting an increase in charitable donations by corporate Barbados and the diaspora.
They have been able to move philanthropy from around $800,000 to over $3 million. So it has been a big injection in equipment mainly. Recently we had 2 new dialysis machines. You would have seen it on CBC News, 2 dialysis machines to bring critical care for dialysis patients. And we know that the demand is increasing there. So we've seen a number of pieces of equipment, the CT scanner, that's also a donation.
Hospital officials have also revealed the Health Information System, which is essentially a digital patient database expected to speed up patient care, is expected to be in place by early next year. Sharika Griffith, CBC News.